members of our community that we've lost over the last few weeks. Related, we have 563 cases. That's up from 537 yesterday. So we have 26 new cases since yesterday. We have 53 individuals in the hospital. This is representing 19% of our active cases. From a percentage standpoint, this is what we've seen. 19% of our active cases, some days it's 18, one day I think it was 20, will be hospitalized. This virus is very strong and it impacts people, it impacts them quickly. This is 4 more patients since yesterday, but again, from a percentage standpoint of our active cases, it's right where it has been. We have 20 individuals who are critical. This is representing 7% of our active cases. This is actually down a little bit, but these are 20 individuals who essentially need help to breathe. Out of our hospitalized, we have 32 Caucasians, 10 African Americans, 4 of another race, and 7 that are unknown. We just don't have all the data from all the hospitals on these 7 individuals yet. Out of those who have passed, we've had 11 Caucasians and 1 of another race, 7 males and 5 females. Today we have 273 people who have recovered and have been released from mandatory isolation and quarantine. This number is up 5 from yesterday. So to give a status check, we have 563 positive cases. That's our red curve. We currently are monitoring 278 active cases. That is our yellow curve. And that total is up 20 from yesterday. 64 in our positive case total are household contacts or from previously confirmed cases. That's the challenge with this, is when we look at our strategy to identify by testing, and then we investigate, and then we quarantine, we box in the virus. We know out of every 10 cases, we'll have at least 1 to 2 positive cases from just household contacts. People that percent are under 60, and 29% of our cases have been over 60 years of age. Breakdown by municipality. City of Syracuse, 226. Town of Clay, 62. Manlius, 39. DeWitt, 33. Salina, 33. Camillus, 32. Onondaga, 27. Cicero, 25. Geddes, 19. Lysander, 18. Pompey, 17. Skaneateles, 10. Marcellus, 5. Otisco, 4. Van Buren, 4. Lafayette, 3. Fabius, 2. Spafford, 2. And Tully, 2. Elbridge still with 0 cases, and the Onondaga Nation still with 0 confirmed cases. Related to testing, we have done 7,412 tests. 7,297 tests have been returned, with 563 positive and 6,734 negative. Again, 6,734 individuals have been sick just with something else. We have 115 pending tests. That is the second lowest number of pending tests we've had since we've started testing. We received 256 tests back since yesterday. 7.7% of those tested are testing positive for COVID-19. Again, after a test, you are in a mandatory quarantine. From that point, you then wait to see if you're negative or positive. Turn times right now in testing are moving quickly, as our hospitals now have the ability to rapid test, and our labs are now really turning times 24, 48 hours. From that point, if you have a positive test, our health department's going to contact you, as would your primary care provider, checking in on your health, your symptoms, and then at that point start our investigation to determine direct contacts. Based off those direct contacts is how we formulate our quarantine. If
once the investigation is done, if there are no gaps in the investigation, any gap would mean we will send out a press release asking the public and alerting the public about a positive case and where they may have been, where they may have exposed the public during a period of time. We've done that consistently throughout this process and will continue to do that. A reminder, if you work at a company and someone at your company tests positive, that does not mean that you are a direct contact. Important to clarify that. We haven't had as many of those inquiries, so I think everybody understands the process at this point. Certainly related to social distancing, we know that the virus has a hard time, as one doctor would say, swimming in 6 to 7 feet of water. So what do? We stay 6 to 7 feet away from each other. That's how we starve the virus. Social distancing, we've gone over. It's working. Our data is reflecting that. How do we really get to the next point in this process where we continue to move this data, we continue to stay away from each other? We had more positive cases today than yesterday. We've also had more testing back. And we're starting to look at some of these positives now. Remember last week we were talking about how some of these were potentially preventable cases. We hope to have the ability to talk tomorrow about what some of the affiliations are that we're seeing and how we can improve as a community on that. But certainly in our voluntary shelter in place, we need you to stay strong. 6 days left. Let's really dive into this, take this seriously. Let's limit our behavior outside of the home to more than 50% from last week. If we continue to do this, we continue to starve the virus from new hosts, we'll be in a position to look at what it looks like in the near future about getting our lives back. And what we can start looking at what does a restart look like. But to do that, we need to stay strong and stay the course right now with social distancing. And again, I want to thank everybody for that. I know this isn't easy, and I know the supermajority of our residents are taking this very seriously, and you are all some of the unsung heroes in this process. Again, I want to thank the parents specifically. I know how hard it is with the kids. And I think our data with positive cases under 19 shows the success parents have had with helping protect their children from this virus. So thank you very much to all of our parents as well. The Plasma Project, if you've recovered from COVID-19, you can play a unique role in this process from the research side of this, which is going to be important. Please contact Upstate and Red Cross. Go to Upstate's website to register for this potentially life-saving research effort. Again, I'm going to go through some numbers and then take some questions. Our Upstate Triage Hotline, this is our hotline. If you don't have insurance, we have a triage testing site. You call this. You'll get screened based off of your symptoms to determine if you go to our Syracuse Community Health Center for a test. Again, this has been a great tool, and please utilize this. The phone number is 315-464-3979. Our seniors, our healthcare workers, an adult nutrition hotline, 315-218-1987. If you are in a situation where you need a meal and or you need help with groceries, other materials, please contact this line. We've been helping with all of our volunteers fill in the gaps for our people who are in need. Child Care Solutions, our solution for daycare needs for our essential business members. Again, free daycare slots for the month of April, 315-446-1220. The idea being here, we don't want grandma and grandpa or mom and dad who have compromised immunity or our seniors being daycare. We have these slots there to help with that. 211 for social and emotional support. This is a serious concern. These times have been tough. We have resources here at 211 to talk to professionals that can help you through this process. And again, there is nothing to be ashamed about for asking for help when you need help. Vera House support, 315-468-3260. There is never any excuse for abuse. If you find yourself in a situation where you need help or are uncomfortable, please reach out to Vera House. The same goes with children. Many of our mandatory reporters, our teachers, are not in the classroom with kids every day. Please contact McMahon Ryan Child Advocacy Center, 315-701-2985 if you have concerns about our young people in the community. We need to look out for our young people. Donations of PPE, 315-435-2525. I'll give an example. We had a request for PPE from a hospital outside the county for large N95s. We don't have large N95s, but we had people donate large N95s, so we were able to help this hospital with that request. That came from a donation from you. So again, thank you. If you have PPE, these are the masks, these are the gloves, these are the gowns that our nursing homes need, that our hospitals need, first responders. Every little bit helps, and you are helping, so thank you for that. Again, to volunteer, CNY, by volunteering for this, you help fill the gaps in our community to help our residents. That number is 315-428-2229. Questions?
What did you learn on your call with Walmart about the testing site in East Syracuse?
Yeah, so first off, we can't have private labs coming in and not sharing data with us locally, so that's our first concern, no matter who they have a contract with. So this Walmart and Quest have a partnership. They have a contract with HHS, with the federal government, to do testing. We have been testing in our community for a while. This testing is similar to the testing we've been doing. So to recreate the wheel makes no sense. But in our conversations, really two things came to fruition. One, they're going to share data with us, because if they weren't going to share data with us, I'd rather not have them in the community, quite frankly, because we need that data to make informed decisions. So we're going to share data. And two, as we move forward in this process, we need to look at the data we have and then potentially implement new testing strategies. One of the strategies we're looking at is testing nursing home workers and healthcare workers. If you work at a hospital, it's easy to get tests right now because they're all doing it. But certainly this site will be used to help us address our need with our nursing home workers getting testing.
So based on the answers to your questions about it, you're okay with it moving forward?
Yeah, I think so. Look, we're appreciative of bringing more capacity in. It's just we're the local response to COVID-19. Your health department, your county government, and we're not just the local response. We're really the regional response when you bring in our healthcare infrastructure. We've been very lucky that we've been working together, and we've made some team decisions throughout this process that have put us in a position that we're in today, where our hospitals aren't overrun, our health department's not overrun. We're able to quickly box in the virus with every investigation. You do that by working together and by sharing information, and that's what we've been doing. Any new partner into this needs to be able to do the same thing, or else there might be another community that can be better suited to join if they need to recreate the wheel. So we're happy. We had great conversations with Walmart, great conversations with Quest. So being part of the team, we want a big, diverse team that can be part of the team.
Did they explain to you why they didn't give you a heads up about this?
Yeah, I think it's a communication failure. I think they learned a lesson from that, yeah.
And did you convince them of any changes? You've mentioned you're happy with the ultimate conversation, but did you have to work through some things first?
Part of their criteria that they look at with their HHS contract is they're looking at the same CDC guidelines we're looking at, but they're using an algorithm. Other parts of what they can do is they can test first responders and healthcare workers, nursing home workers. That's part of what in their contract they're allowed to do. So when you look at what they can do and you look at where our needs are in this process, our needs are more focused around let's help us get nursing home employees tested. Why is that important? It's important because if you're in a nursing home, you're not going anywhere, right? If COVID's going to spread, it's because of the employees coming in. So let's look at this. Let's mitigate that risk from our nursing home residents and box in the virus with whatever employees have it. So that's what the need is in our community right now. We don't need, there may be others that get tested that way as well, and they may end up having people come in from outside the community and use that as well, just like we've had at our triage site. That's why we have to share data. But to meet our immediate needs as we enter in kind of a new phase of testing, if we continue to starve the virus, our testing demand each week, based off of the guidelines we've all been using, will slowly diminish. And that allows us with capacity to do different things with testing. And that's kind of where I see us now. We know that nursing homes are dense. We know that the way that the virus gets into these buildings is through employees. We don't want outbreaks in all our nursing homes. Let's test the employees. That's where we are.
You're talking proactively test these employees,
Correct.
not symptomatic
Correct.
employees. And so will this not be open to the public?
It's open to the public, but there's going to be a emphasis at the beginning part of this process that capacity is utilized for nursing homes. There's a process with this. You have to go online, you got to do an application and whatnot. So the Quest Walmart teams will be given nursing homes that we'd like them to reach out to and start that process.
Last question on this. Do you know when they will start actually testing people there?
I don't know the exact date, Andrew. I know initially there was a potential of a Friday start date. We need to get back together and figure out if that's still a go or not.
So because of your conversation, you're already slowing it down to make sure it's more strategic.
Yeah, it needs to be. We can't, we're a community that's been on top of this. We've had a plan, an emergency plan since day one. We're not going to change our plan because of a new initiative. That initiative needs to be part of the plan, and we're happy that this is working out.
Is there any concern that it is a Quest testing site? Because I know way back people were a little frustrated with Quest because it was taking a while for them to get their results.
Yeah, and so I think they've worked out some of their issues. We had that conversation, and part of it was they're our triage testing site. The first few days they got slammed, and I think that was kind of the first few days that every other community doing what we were doing could do it, so they got slammed nationally. But this is not the only testing site. Okay, so we have Upstate, we have Krause, we have St. Joe's, we have Syracuse Community Health Center, we have primary care providers. So we have so much more capacity now that I'm not worried about it. And we have rapid testing at some of these sites. So we're going to be getting, for example, we have 100 and, I don't know, what do we have, 115 pending tests. Tomorrow, I can almost promise you, we will have received back more than 115 pending tests. Why is that? Because we have some testing today that we don't know about yet that will have the results back that quick. So that's where we are in this process. We're not waiting 4, 5, 6, 7 days to identify, isolate, fact find, and quarantine. We're boxing it in now within 24, 48 hours.
You mentioned nursing homes, and I think you said that the person who died most recently was in his 90s?
Yes.
Was he a nursing home resident?
I don't have that information yet, Tim, because this is today, hours we ago, but certainly if he was, we'll know that and we'll communicate that.
What is your reaction to the governor's order for people to be wearing masks now in public?
I think we've been recommending it. We were never going to regulate it unless we could give a mask to somebody. But I think it's very wise that people, when they're in public, wear a mask. It's risk mitigation. And what more important asset do we have altogether than our own health? So I think it's in all of our interests to have that, and it'll be interesting. I think if there's runners, I don't know if they're going to run with one of these, how well that's going to work out. But I think when you're out in public, it inspires confidence with employees of companies wearing masks and everybody wearing masks. As funny as we all may look, if we're all doing it, we'll all look funny at the same time. And that inspires confidence within people who are out when they're shopping, because people are very nervous about when they go out. So I think that will inspire confidence. It will help with anxiety, but it will also obviously help, as we know, saliva and coughing and sneezing help push this virus towards new hosts.
So will the county now be I mean, you guys have been recommending it, but will you guys be enforcing it now?
Yeah, I saw some of the verbiage about that. It's going to be very hard for us to enforce people wearing masks. Mind you, we're operating, for the most part, our departments. Now, law enforcement's different. They're not at 25% capacity. They're at 100% capacity still. But for us to realistically be able to enforce every person in the public doing that, it's just not realistic. This is Good Samaritan. We're all in this together. Let's act like it.
My last question on that, sorry, is just one of our viewers did ask, do children have to wear masks in public? And I wanted to see if you knew anything about that.
I think it's just, we've been encouraging folks not to take their children to the grocery store. We've gotten reports, I had a call with grocery store managers today from all the chains, and they've seen a lot less kids in there. There's no reason when you're going to do this, this isn't like a social activity anymore. It used to be, I would take Andrew McMahon to Wegmans. Andrew McMahon demands a cookie right away. We go get him a cookie. It's a fun thing to do with Dad. We don't do that anymore, right? There's just too much risk. It makes people uncomfortable. So that's important. I think getting little masks for your kids or some form of facial guard, if you're going to go to public parks, will make people comfortable. I didn't see the governor's order if it applies to little people or not, but I think it's just that will make people comfortable. It's the right thing to do if you can.
We have heard from a concern from parents, though, about very, very young children not wearing them because it could restrict their breathing. Are there any limitations that you're aware of? And I mean, I'm not a parent, so I'm not sure what the general rules are.
Look, you don't, you got to breathe, right? And so if you have an infant or a toddler, this is what keeps parents up at night when they're going to sleep, and you wake up and you go check on the little one to make sure they're still breathing every night. You're not going to put, certainly, you're probably not putting your toddler or infant in a situation where they're in these places right now anyways. If you are, certainly they're probably in some sort of car seat carrier. You can probably protect the car seat carrier throwing a blanket over the top of it. Just some parenting advice I can give them out right now. But I don't think if I hear about a law enforcement officer enforcing a 2-year-old with a mask, I think that's kind of getting silly.
Has the health department identified any patterns among the 12 people who've died?
I would say 10 of them had symptoms. You know, they not symptoms. They had they all had underlying medical issues before, and that is certainly, I think, when you look at the decades of how old they were too, what the fear was is that this impacts seniors more than it does young people. It certainly does when you look at the hospitalizations and the deaths. Certainly what this process has proven is that you can be in your 20s and socializing a lot and get this, because our highest demographic is our 20s still. That's a lot less now than what it used to be. Remember, we used to have the percentage was well over 40 for under 40. That's changed in this process, but certainly I think if you're a senior who has other medical conditions, this is a bad virus, and we want it nowhere near you.
That means 2 people have died that didn't have underlying conditions?
Correct.
And what would the pattern be among those 2? Why this took their life?
Because this is a SOB of a virus.
You urge people to keep the faith for 6 days on the voluntary shelter in place. What do you envision happening in 6 days?
I think in 6 days, if we can really hunker in, the data is going to improve. We know that there's an April 29th state and April 30th federal guideline on really a stay at home unless you're essential business type situation. And we need to continue to social distance and starve until we get back. But with improved data, the faster this improves for us, the better argument we have to New York State to treat Central New York as its own region, as its own restart. If the data doesn't show that we're ready for that, then we're going to have to go week by week with the data. So I guess the way we always thought about it with the voluntary shelter in place is do it early enough where you start to move your data so that your data is showing significant progress before the April 29th and April 30th date, so you can start to have a conversation with New York about what do they expect with a restart, and what does that look like? And I think we heard from the governor, he was saying things similar that we've been saying throughout this process, is you probably have a restart with businesses that are deemed non-essential. Everybody, look at any business is an essential business to somebody. So these are deemed non-essential businesses that can operate in social distance at the same time. And then you phase in a percentage of those. And then you look at your healthcare systems. These are folks that are educated in disease prevention to begin with. This is their training, this is their craft. How do we get these furloughed workers back to work? We get enough PPE in so we can start elective surgeries again, and you phase in those elective surgeries so that your hospitals are functioning again, your businesses that can work in social distance at the same time come in again, and then you're in a situation where you have more density in the community, and then you're testing this virus, and you see how this virus reacts. And by having the data in the right place, that means our health department, our COVID team, is then ready and willing to react and respond to a case because we now have rapid testing, and we isolate it, we investigate it, and we box it in and quarantine it again. And I think that's how, until we have a vaccine, for us to get back to normal, that's how we have to behave and how we phase this in. And once we see how it responds through phase 1, then you look at a phase 2.
Is the key metric the yellow line of active cases?
Yeah.
You need to see that start heading in a downward direction?
Yeah, I think it's, look, basically I think it's flattened out. Today I had a little bit of a bump. I think hopefully tomorrow we'll be able to see some more. We might be noticing some affiliations that might taint the data a little bit. Hopefully we'll know more about that maybe tomorrow. But if you have a flattened yellow curve, when that yellow curve goes down and the green curve keeps going up, you'll see the red curve start to flatten out. And I think the yellow curve is the key curve because that, for us to do a restart, our health department needs to almost be waiting for that next case to go tackle it and then investigate it and quarantine it. And so for us to get to that point, that yellow curve needs to be going like this.
What affiliations are you concerned about?
We don't know yet. We're looking into some potential affiliated cases that might be pushing our data, that yellow curve up a little bit. We're not prepared to talk about it yet, but maybe tomorrow we will be. Because there's community spread, but then you could see affiliations that you can point out and say that's why those went up, and it's and that's what we're working through right now.
Yesterday you talked about taking a little bit more oversight into nursing homes, and other than testing some of the asymptomatic workers, do you have an update on what you might do?
No, we've said we feel at this point in the process, when you look at where you feel and you're trying to figure out on a proactive standpoint where you could be vulnerable still. You can be vulnerable where there's density. Nursing homes are one of them. We feel we've seen what's happened in other parts of the state with nursing homes, and we believe we can help New York State, just like we've helped Suffolk County, just like we've helped other counties when they've needed emergency PPE. We want to help New York State because these are county residents still. So even though we don't have the legal jurisdiction here, we think that we can help and implement strategies that will prevent potential problems down the road. And we want to. We want to.
Ryan, what do you make of the differences in infection rate in the zip codes within the city?
Yeah, we're looking at that, and we're looking at some potential affiliations that are driving some of that density there. And there may be some affiliations that explain those shades, and we're not quite ready to make those conclusions yet, but hopefully we will be soon.
Do you think those have to do with failure to observe social distancing, or is there something else maybe going on?
We'll see. There might be different things going on there. I don't think it's necessarily just a social distancing issue. Other questions? Okay, I got to give a big shout out to some of my team here. For everyone, I know everyone knows this, and this is just a reminder for everyone, but this is National Public Safety Telecommunicators Week, and I would like to thank everyone at our 911 for the fantastic work they've done, the way they've pivoted and adjusted. I don't know if everyone realizes this, but in this process, when we were in the heat of the moment with COVID, at one point, our 911 is on the same system as New York City. And at one point, dispatching calls became a challenge in New York City, and our 911 stepped up in a big way to help out. And Commissioner Julie Korn and her team do a great job serving this community every day. And our dispatch times are exceptional and continue to be professional. And in this time of heightened anxiety, I'm very proud of our dispatchers for how they've worked with the public and treated them with dignity at all times. So I want to give a big shout out to our 911 team and Commissioner Julie Korn. Thank you.